Now we come to the part where I present clinical evidence based on peer-reviewed literature. This part includes more medical terms, but I would like to summarize the clinical evidence for you, basically allow the evidence to speak for itself. I couldn't possibly cover all health topics, so I will focus on what I believe to be the most relevant and important ones. Here is the table I summarized for you, the clinical indications in the magnesium supplement in various health conditions. What you can see is the conditions, the type of studies included, and the results by numbers. Please keep in mind that this table may change in the future if we have more studies coming up. For the time being, I will recommend you to take a screenshot, or if you don't really have time to go through all the videos, you can just refer to this table for reference. Okay, let's start with the cardiovascular and metabolic disease. Magnesium plays an important role for vasodilation, which is something that patients with hypertension needs. One of the proposed benefits for DASH diet that designed to control hypertension is not only including potassium and fiber in the diet regimen, but also the magnesium. In a meta-analysis published in the Journal of Hypertension, which included 34 trials, it was found that magnesium can lower both systolic blood pressure and diastolic blood pressure by 2 and 1.78 mmHg at a daily intake of 368 mg. These effects are also dose-dependent, meaning that if you take more magnesium supplement, potentially there is additional benefit. While the reduction may not be dramatic, the evidence is robust and certainly something worth considering. If you want to take for patients with hypertension, I would suggest you take it more than 400 mg a day. In terms of the stroke prevention, a 2019 meta-analysis involving 700,000 patients revealed that the highest magnesium intake compared to the lowest can potentially reduce the incidence of stroke by a notable of 11%. This effect was particularly prominent in patients with ischemic stroke, which is mostly caused by the blood clots. So there are two types of strokes. Ischemic stroke is usually caused by the blood clots, and hemorrhagic stroke is caused by the bleeding. And magnesium supplementation has more effect on ischemic stroke prevention. Notably, the data demonstrate a dose dependence as well between the magnesium intake and the risk of ischemic stroke. Let's delve into diabetes and metabolic disorders. Magnesium deficiency can have detrimental effects on our metabolic function, such as increased inflammation, increased insulin resistance, and increased oxidative stress. This graph just illustrated how the magnesium affects multiple cell signaling pathways that can lead to insulin resistance. This is an interesting meta-analysis that examined 25 randomized controlled trials involving patients with diabetes or those at high risk for developing diabetes. This analysis revealed that magnesium supplementation did not reduce fasting glucose levels in patients with diabetes, but there were no significant difference in other outcomes. However, in individuals who are at high risk for diabetes but not have been diagnosed with diabetes yet, magnesium supplementation was found to reduce fasting glucose level, 2-hour oral glucose tolerance test, OGTT results, and the HOMA-IR, which is a marker for insulin resistance. It's worth noting that only 2 studies addressed hemoglobin A1C, so there wasn't sufficient data to draw meaningful conclusions regarding this outcome. In the context of metabolic disease, it is essential to know that this meta-analysis revealed an inverse relationship between the risk of metabolic syndromes and the daily magnesium intake. It is important to emphasize that while this meta-analysis only included epidemiology study, not intervention study, so we cannot establish causation. However, it is a noteworthy phenomenon that warrants attention and further investigation. Lastly, I would like to highlight an interesting study conducted in the Netherlands involving a diabetes cohort of 4,300 patients. over a 5 to 6 year follow-up period, it was observed that serum magnesium level, and typically a late manifestation of magnesium deficiency, exhibit an inverse association with both the micro and macrovascular events, heart failure, and kidney disease. I think while it may be wishful thinking to rely on magnesium alone for diabetes prevention, I firmly believe that magnesium should be integrated into diabetes care plans, particularly for those patients who are at high risk for magnesium deficiency. The physiologic mechanisms at play make a compelling case for its inclusion. How about migraine? Migraine management often leads me to recommend magnesium supplements to my patients. In 2012, the American Academy of Neurology conducted an investigation into the complementary treatments for episodic migraine prevention. They classify magnesium as a level B interventions, signifying it is probably effective for migraine prevention, similarly as phenylprofen, ibuprofen, ketoprofen, naproxen, and riboflavin. In 2017, the American Headache Society also conducted a systematic review of magnesium supplement for migraine prophylaxis. This review encompassed a total of 5 studies, with 3 of them indicating a reduction in the frequency of migraines. Among the 3 studies, 1 had a very low risk bias, while 2 had a moderate risk of bias. So the effective dose in those trials for migraine prevention was found to be 600 mg per day, slightly higher than our recommended daily allowance. However, it is also worth noting approximately 28% of patients can experience diarrhea as a side effect at the 600 mg per day. In conclusion, this article suggests that magnesium supplementation for migraine prevention is possibly effective. So I recommend considering migraine prevention for using magnesium supplement, especially for those individuals whose migraines are not severe and may be related to menstruation or nervousness. Of note, magnesium could be helpful for patients with premenstrual syndrome, a topic that I will cover in the future. Lastly, let's talk about osteoporosis. Magnesium has shown the ability to inhibit the activity of osteoclasts, the cells that are responsible for bone resorption. This naturally raised the question whether magnesium supplements could be beneficial in managing osteoporosis. However, to date, most studies have been only cohort studies, with randomized controlled trials being relatively rare. There is one meta-analysis that published in Journal of Bone shed some light on this. This study indicates that higher magnesium intake is associated with a greater bone marrow density in the hip and the neck area. However, there is not enough evidence for the benefit for lumbar spine or overall fracture risk. We can hope that in the future, more intervention studies will provide further insight into the potential benefits of using magnesium in managing osteoporosis. This is the last slide, and I conclude my presentation. Please reach out to me or leave the message if you have some questions regarding my presentation. Thank you for your attention today.